Today we celebrate the release of the Stanford Department of Medicine 2022 Annual Report. I'm Bob Harrington, Department Chair, and on behalf of the department, I want to thank everyone who has contributed to the successes we share with you today. Over the past year, our faculty, staff, and trainees have tackled many local and global challenges. We've weathered new COVID-19 variants, and we've seen patients struggle with long-term symptoms of COVID-19. We've faced off against diseases and chronic conditions that remain all too common, and we've grappled with systemic health inequities. The 2022 Annual Report presents stories that embody how the department has risen to face these and other challenges in the past year. Nearly 3 years into the COVID-19 pandemic, millions of people are now grappling with long COVID symptoms. In May 2021, Stanford Medicine launched the Post-Acute COVID-19 Syndrome Clinic. The PACS Clinic now has several hundred patients and a months-long wait list. The clinic is also participating in a nationwide research effort to understand long COVID biological mechanisms and to find evidence-based ways to prevent and treat the disease. In other research news from this year, faculty in the Blood and Marrow Transplantation and Cellular Therapy Division have developed a new treatment for people with acute lymphoblastic leukemia. The researchers are now enrolling patients in a clinical trial to test an approach that combines bone marrow transplants with immunotherapy. Participants will receive a transplant that includes a cocktail of specially engineered T cells. The trial combines multiple avenues of Stanford research and has the potential to change the paradigm for ALL treatment. On the education side, a new teaching framework called the 5-Minute Moment for Racial Justice emphasizes meaningful connections between medical trainees and Black patients to build dialogue, challenge biases, and promote racial justice in healthcare. The framework draws on community-based research on Black patients' experiences with health inequity and perspectives on how clinicians can earn their trust. In the annual report, you'll also read about endocrinology research on hormone therapies for transgender patients and a new tracking system that has dramatically improved kidney transplant rates. You'll learn about new research on eco-anxiety in youth around the world and development of technology designed to help doctors manage their patients' blood pressures remotely. Every year brings challenges, some new, some old. I like to think that every year we rise higher in our efforts to meet them. I certainly see evidence for that when I look at what we have accomplished in the past year. I'm pleased to share these stories and many more with you in the 2022 Department of Medicine Annual Report.